Good morning to all. My name is Clement, Professor, Mandya Institute of Nursing Sciences, Mandya, and she is Jyoti, Assistant Professor, Mandya. Clement, Professor, Mandya Institute of Nursing Sciences, Mandya, and this is Jyoti, Associate Professor, Mandya Institute of Nursing Sciences. Today we are going to demonstrate female catheterization procedure. I understand this is a laboratory demonstration, a kind of simulation lab, and there are some prerequisites for this. Example, side screen. This is lab. Assuming that we have side screen, we are going to carry out this procedure. And catheterization is a procedure wherein we are going to insert a rubber catheter. Mainly, we are using police catheter. So this is unsterile. Just for demo purpose, I am showing you. This is known as police catheter. Actually, it is having two lumen. One is for draining the urine from the bladder. Another one is for inflating the balloon. If you observe closely, here they have written the gauge, the size, 16 FR. 16 FR means that is the dia, the French gauge FR. Okay. So 5 ml, what they have written is the capacity of the balloon which is going to inflate. Okay. So the inflated balloon retains the catheter inside the bladder. So it is also known as indwelling catheter. It is named after American urologist Patrick Foley. Right? So this is one unsterile one. At the end of this video, I will show you how the balloon will be inflated. So here they are given 5 ml. In the sense, you have to generally push 5 ml of sterile water for inflating the balloon. But still we use 10 ml for more secured placement of this catheter. Okay. And there are some other catheters, I told you, in which it is written 30 ml. So that is used in some males where the catheter may slide down up to prostatic fossa. So that is a different condition. We explain it when we demonstrate about male catheterization. So for now, so this is dual lumen. There will be 3 channel or 3 lumen catheter also. Another one will be used for bladder irrigation or for bladder washing. That's fine. And next, see, you can see madam is standing beside me because the protocol says whenever a male healthcare worker or a doctor or a nurse is performing any procedure on female patient, so it should be accompanied by a female attendant or a healthcare worker or a nurse. So that's the reason madam is standing for the assistance. And second part is always, it is applicable for almost all the procedure, expose the minimum required area. It's not like that I'm doing catheterization and I'm removing all the cloths unnecessarily. So even we have used this cloth, or you can call bedsheet, for draping the areas. So we prefer dorsal recommend position. Okay. So if you just lift it up, it will expose the genital area required for catheterization process, right? So this is a unisex dummy wherein we can replace the genitals. Even for demonstrating male catheterization, we can replace that particular part. Okay. So coming to the procedure. First, we should know the length of the urethra in females. So it will be around 2.5 to 4.5 centimeters. Take 4.5 centimeters. So of course, when you are inserting the tip of the catheter, you will insert up to 5 centimeters. Some people will recommend to push it in up to 5 to 7 centimeters also. Because after inflating the balloon, we can slightly pull it and up to the inside bladder, we will be having sphincters, right? Internal sphincters. Up to that level, balloon will come and fit. Anyways, so size of catheter, that also matters. So what it is written here? 16. So in females, what we do? 14 to 16 kg is enough. If a female is less than 12 years of age, we can select between 12 to 14 kg. That is French gauge. Okay? So that's the thing. So now let's go with the procedure. Of course, no doubt, we'll wash our hands and we'll be having 2 pair of gloves. Why? Because 1 pair I am going to remove it after the cleaning of perineal area. Okay? So to save time, so assume that and it is already done, hand washing, and then with the 2 pair of glove. Okay? So secondly, winning the confidence of patient. So always you should explain the procedure to the patient. It will reduce their anxiety and you can get their cooperation as well. Okay? These are the basic things. So now I ask the madam to pour the betadine solution into your bowl to start the cleaning process. And remember, you have studied in other topics also. The cleaning technique always follows the principle. What is it? Cleaning from area lesser contamination to higher contamination. Same thing you are going to see here. See? Somebody please come to the tray. Focus here. See, we are already having required articles assembled near the patient side. So we are having sponge body faucets, we are having sterile water, easy fix for fixing the cannula, and catheter, sterile catheter, Eurobike, xylocaine jelly, kidney tray to collect used sponge. Okay, so let's go with the cleaning procedure. See, with the sponge body forceps, I'm taking the gauze, I'm dipping it into the betadine solution. Macintosh is already placed to avoid the soiling of bed. Right? See, first I will clean from clitoris to vagina in one stroke. Remember, each gauze for one stroke. After that, you are not reusing. Okay? So, second one. With the non-dominant hand, I am just widening the labia minor. Okay? Next, I am cleaning around the periphery area of vagina. And at last, from vagina to rectum. Care must be taken here, only one stroke, because rectum is highly contaminated with fecal blood. Okay, so keep it in mind. Always we side this time in the right side of the patient, because some of the procedures are carried through my right hand if I am a right-handed person. Okay, so it is, if you are a right-handed person, stand right side to the patient. Okay, so what I have done here, what I have shown the procedure, same thing you have to follow with the saline. So the cleaning strokes and the methods what I have shown. So you are going to do it with the saline one, right? Starting with clitoris to vagina. Secondly, slightly opening the labia minora. Then vaginal area or periphery of the vagina. Finally, from vagina to are going to repeat. First I did it with betadine, you are going to repeat it with saline. So assuming that we have completed the process, now I will ask the madam to give me the catheter. See, now, after the cleaning process is over, I remove my first pair of glove. Here is a mark. I will remove only upper part of the catheter and I will ask the madam to assist me. So she is applying silicone jelly. Okay, so that the tip may be lubricated for easy insertion into the urethra. Okay, so observe here. I may ask madam to eliminate the area because sometimes it may not be visible. Please. Here, see, you have to differentiate between the vaginal orifice and external urethral opening or urethral meatus. See, that is the key part here. And we will keep the kidney tray as well because as soon as you insert, the urine will drain out. See, once you differentiate the vaginal opening, above that you can find the urethral orifice or urethral meatus, urethral opening also you can say. Just insert it gently. Okay, you can insert up to 4.5 centimeters or even 5 to 6 centimeters also. Okay. So after that, I am going to remove the remaining part of the cover. Assume that it is a patient with filled bladder. So immediately the urine starts flowing here. So I am just pinching it and we will connect the urobag, urine collecting bag. So once the urine bag is connected here, so it will start flowing into this bladder. So this urobag is having the capacity up to 2000 ml. That is, it can collect up to 2 liters of drained urine. So now the inflating part. See, we already loaded 10 ml of sterile water to inflate the balloon of the catheter. And remember, after doing the procedure, you have to document in the case sheet that how much ml of sterile water is used to inflate the bladder. Because if you are not in duty and the patient is discharged and other nurse may assume the inflating volume was around 5 ml and she may withdraw only or aspirate only 5 ml. Okay, and if she pulls out, then it becomes injury, right? Understood? Okay. So this is the method, and then you can remove the kidney tray. Please continue this. You can remove the draping cloth as well. Generally, we can secure the urobag to the thigh using adhesive plaster or easy fix. Europack can be tied to the cot end wherever the provision is available. This is the procedure. And for your knowledge, I'll show you. Positively. This is indwelling catheter, police catheter, having two lumen. One is for draining the urine out from the bladder, and another channel what they are given here, it is for inflating the balloon. Right? Here recommended is 5 ml, but we do
10.
how much? 10. Yes. We usually inflate for 10 ml. Can you see? See now the balloon is inflated. So what is the idea behind it? This will hold the catheter in place within the bladder. If the patient moves side by side or some other body movement, the catheter will not come out. Understand? So this is the idea in belly catheter. Usually it will be there for 3-4 days at least. Okay. So other type of catheter is temporary one. We do not call it as indwelling catheter. That will just serve the purpose one time use. Just any patient comes with urinary retention, that time we use it, we drain it out and we discard it. So hope you all understood the indwelling catheter, this police catheter, and the technology, how it works. So if the bladder is pulled also, with the pressure of the urine, this particular catheter is not pushed out from the bladder. This balloon holds, prevents the catheter being pushed out from the bladder. Hope you all understood. Thank you.